for these things. So is it visible?
Yes, sir.
Okay. So what is a definition? First you have to define what is a cardiac reflex. It is a fast-acting reflex loop between the heart and the central nervous system. So it is mainly for maintaining the physiological homeostasis. So it is a fast-acting reflex loops between the heart and central nervous system that contribute to the regulation of cardiac function and maintenance of physiological homeostasis. This is the basic purpose of these cardiac reflexes. So you always immediately start with the baroreceptor reflex. You say what are the sensors. It is the pressure which occurs at the carotid sinus and aortic arch, and the afferent pathway is through vagus and glossopharyngeal nerves. The processor, where that is the center where it is getting processed, is the nucleus of the solitary tract and the nucleus ambiguous, and efferent is vagus nerve and sympathetic chain. And the effect is increase in heart rate and BP in response to fall in BP. Okay, so this much of answer is more than enough, and this is just for you to understand. You can't, you don't have to waste your time in writing all these things. So the input is imposed a decrease in arterial blood pressure, sensed by arterial baroreceptors as a decreased stretch. So decreased baroreceptor afferent nerve activity and the signal processing in the medullary cardiovascular control pathways. The output can be increased sympathetic activity to increase the heart rate, increase force of contraction, arterial or vasoconstriction, or decrease parasympathetic activity and decrease, which also enhances the heart rate, resulting in arterial blood pressure. So there is a stimulation to sympathetic and a blockade of parasympathetic, both happening, which ultimately results in restoring the blood pressure. And next is the Bainbridge reflex, also called the atrial stretch reflex. Here the afferent is vagus, where the atrial stretch happens. The processor is nucleus, again the same vagus nucleus, and the caudal ventral medulla. The efferent pathway is vagus nerve and sympathetic chain. The effect is increase in arterial pressure produces the increase in heart rate. So as Anjali was mentioning, this is the relationship between Bainbridge and baroreceptor reflexes on the heart rate. So if you see the intravenous infusion occurring, and there is an increase in right atrial pressure, which stimulates right atrial receptors, then Bainbridge reflex activates, increases the heart rate. Whereas with the baroreceptor reflex, there is an increase in cardiac output, increase in arterial pressure, which causes baroreceptor reflex, which will try to decrease. So both act as a counter-regulatory things. And what she mentioned about reverse Bainbridge is, in spite of when there is a decrease in the atrial stretch, there is a bradycardia. So that is the one which is responsible for the occasional sudden cardiac arrest after a spinal anesthesia, which I told you was asked in one of the OSCE as a question. Next comes the chemoreceptor reflex, where the afferent is the carotid and aortic chemoreceptor, which sends the low oxygen as well as high carbon dioxide, and it is processed again at the, most of them are processed at the vagal level and the nucleus ambiguous, and efferent is vagus nerve, again sympathetic chain, and the effect will be bradycardia and hypertension in response to hypoxia, and also secondary tachycardia from Bainbridge and Herring-Brewer reflexes, which will be like to compensate for that. So this is a picture for you to remember how the locations. This is the carotid body, this is the aortic body chemoreceptors, and then from there the afferents goes through glossopharyngeal and vagus nerve. So it should have been the afferent should have been from this through the nerves, glossopharyngeal and vagus. That also to be included in that. And there is a cardio-regulatory center, vagus nerve center, which is a parasympathetic effect, and that comes on the heart to produce what is called bradycardia and hypertension. So the chemoreceptor centers in the medulla oblongata are there, and simultaneously there will be immediate compensatory mechanism by which the sympathetic also will be activated. So it cannot remain long for that persistently unless patient has got other associated pathologies. Then Cushing reflex is another one. Did you mention this?
Yes.
Okay. Receptors in the rostral medulla and processor is rostral ventrolateral medulla. The efferent pathway is sympathetic fibers to heart and peripheral smooth muscles, and the effect will be hypertension, and immediately once hypertension is there, baroreceptor reflex will cause bradycardia. So that is how that triad in Cushing's: hypertension, bradycardia, and respiratory uh, irregularity. All the three occur. So there is a raise in ICP causing Cushing reflex, which results in hypertension and bradycardia and irregular breathing, even though the stimulation is causing hypertension is the secondary effect is due to baroreceptor reflex. And next one is basal gyrus reflex. Again, the afferent is vagus and processor is nucleus of solitary tract. Efferent again vagus and sympathetic chain. And the effect will be hypotension, bradycardia, in response to atrial stimulation. So this picture shows reduced venous return may cause this reflex to get activated, stimulates the ventral mechanoreceptors, and this reverse Bainbridge reflex comes in, causes stimulation of decreased stimulation of atrial stress receptors. Then there is a pacemaker stretch reflex which is happening. So there is always an association between basal gyrus and reverse Bainbridge reflex. Afferent signals travel via vagal fibers and vasomotor center, reduce the sympathetic and increase parasympathetic outflow, promotes bradycardia and vasodilatation. So it can all these things lead to the vasodilatation, which should be normally contracted by tachycardia, but here it will be bradycardia. So this is the schematic interaction between these three reflexes. It is basal gyrus, reverse Bainbridge, and absence of baroreceptor reflex. Then oculocardiac is very common in spin surgery. Afferent is trigeminal nerve, and the actual stimulus is the pressure on the globe of the eye, and it is through the trigeminal nerve and its center which is causing the processing, and efferent is by vagus and sympathetic chain, and the effect is vagal bradycardia, systemic vasoconstriction, and cerebral vasodilatation. So this picture is for you to just remember the pathway. So stimulation from the eyeball or the eye muscles carried by long ciliary and short ciliary nerves going to the Gazerian or trigeminal ganglion, which has connection to the motor nucleus of the vagus, and then the effect is due to the vagus nerve. And the diving reflex, afferent trigeminal, and the stimulus is cold temperature or pressure, and processor is fifth cranial nerve and nucleus of the solitary tract, and the efferent is vagus nerve and sympathetic chain, and the effect is vagal bradycardia, systemic vasoconstriction, and cerebral vasodilatation. So in this picture, you can see all the stimuli is going through the trigeminal from the cutaneous receptor, ophthalmic, direct, indirect, all these things goes to the trigeminal ganglion, pons, and ultimately it can cause apnea. That is when you dive into cold water. Sometimes your breathing automatically stops, or you dip a child in cold water. Then the child holds the breath and goes into apnea, and bradycardia and bronchoconstriction. All these things can happen. Then there is a what is called the Barcroft Adorn reflex or vasovagal reflex. And the afferent is emotional distress and hypovolemia. And how it is happening, nobody knows exactly. And the afferent is vagus nerve and sympathetic chain. And the effects are bradycardia, systemic vasodilatation, and hypotension. So vasovagal syndrome is said to have four distinct phases. It is a very transient reflex. So majority of the time it may look alarming, but majority of the patients recover. So they have found four distinct phases in that. One is early stabilization by normal baroreceptor reflex. Second is a circulatory instability where baroreceptor vasoconstriction has happened. And three is terminal hypotension, bradycardia, cerebral hypotension, and systemic vasodilatation. And the fourth phase is the severe phase. That patient automatically recovers from it. But to aid that, what you can do is put the patient flat supine and then raise the legs and try to help the venous return, and it will immediately pick up. So sometimes you do come across this when the patient is given a intramuscular injection and a very frightened patient, they swoon, fall down. So all these things many of you would have seen, but it is luckily not a very dangerous reflex that is going to happen. And lastly, respiratory sinus arrhythmia. There is a central respiratory pacemaker, and it is the nucleus ambiguous of the vagus, which is important. And the efferent is through vagus nerve, the ganglion. So this is how the connection goes between the respiratory center and the nucleus ambiguous of the vagus, going through all these nerves, and then the medullary to caudal and rostral ventral to medulla, dorsal horn, sympathetic chain. So this is a very complex mechanism by which it will affect and cause increase in the heart rate during. The primary reason for this heart rate fluctuation is an interaction between the medullary respiratory and cardiac centers. And this is how the last picture that I wanted to show you is, you can just describe these five reflexes. This is baroreceptor, chemoreceptor, Bainbridge, basalt, oculocardiac. These five reflexes are mostly useful to us as an anesthesiologist, whereas the respiratory and vasovagal we don't come across much commonly. So if you can put a tabular column like this, the name of the reflex in the first column, then the stimuli, the receptor, the afferent, the center, the effector, and the response. So if you put a column like this, you can finish off the answer in 10 minutes, within the 20 minutes available for you. So all of you can remember this tabular column, and that will be easy for you to remember rather than writing individually each and every line. Okay. Copy that.